Many people have asked me recently, is it okay to do bridge, the position called bridge, for their lower back, for their glutes, and so forth? The answer is maybe. For some people, a traditional bridge, which I'll show you in a moment, is painful. That includes myself. So some people can do bridge if you do a modification. That's what I'm going to show you here. A lot more of you will probably find that bridge is more comfortable when you employ the modification. So a traditional bridge looks like this. Feet in the floor, spine is flat in the floor, and you simply push up like so, right? So this is where some people run into problems, is when you try to get straight here, the lower back joints and posterior discs might get pinched, and this can be uncomfortable for a lot of you, okay? So modification number one is, if you're doing bridge for glute work, for hamstring work, for core work, is core brace, right? So contract your core slightly. And then when you push off the floor, come off that much. That's it, okay? So you're keeping this scalloped out here. You're not coming to full extension in the lower back. You just have to come up this far, okay? So right now, I have my core contracted, my glutes are doing the work. Well, let's make this even better. Is if our feet go a little further away, there's going to be more glute involved here, okay? So again, you can see I'm off the floor just an inch, keeping this bent in that direction, okay, which will take pressure off the lower back structures. Core is contracted, glutes are doing a good amount of the work here. Well, let's make it even better. Look at my feet. Feet are flat right now. If you drive the heels in, it's going to make it more of a posterior element workout, okay? So now you're going to be doing more hamstring and glute, as opposed to a little less when you're doing it like this. You'll feel the difference when you do it. You'll feel the difference. So driving the heels in here like this, okay? So again, keeping this bent in here is key number one. Contract that core a little bit all throughout the exercise. Get the heels a little further away from you, or even here if you want to make it a little bit tougher, right? And then lift those toes up, so you're driving the heels down. You're going to get more hamstring work and more glute work, and you're going to keep the pressure off your lower back. As you progress along and you get a little bit stronger, if you watch my legs and my feet again, you can lift one leg off and straighten it out. Now you can see my right heel is driven into the floor, doing all the work, much more difficult on that right side right now. And then you can alternate. Left heel goes down, right leg straight, driving in through. I can really feel the hamstring and the glute on this side working. But notice I'm still keeping this bent down to the floor, not pinching those lower back structures, right? So here's what the two-footed bridge would look like. Heels away from the body, toes are up. Keeping this nice and bent in here, I'm just lifting off enough to be off of the floor like so, and then hold. A little bit of core brace, as I call it, or core contraction. Those modifications to bridge seem to work really well. We take a lot of people that are doing bridge in workout classes and so forth, and like, my back bothers me and so forth. We employ these modifications, good things happen. I'm Dr. Scott Fuller.